Hi, I'm Dr. Mike Milligan. We're here at the American Academy for Oral Systemic Health meeting, and I've got one of the main speakers with us here, Feroshia Knight of Portland, Oregon. Whole Person Coaching is her company. Feroshia, thank you so much for being with us.
Thank you.
Now, you gave a wonderful talk to us, and it had to do with a 5-step process that you can do in 7 minutes about speaking with our patients, the dental team, how to communicate with the patients to get across the idea, the whole message of oral systemic health. Can you explain that a little bit to us and expand on that?
Absolutely.
Thank you.
So the first thing to think about is what is naturally what a dentist does.
Okay.
We educate, we ask for their permission, and we proceed with the procedure. We schedule it. I mean, it's pretty much education, treat, education, treat.
Right.
What I'm hearing is there's so much value for having what I would say, a co-management of the patient's healthcare, meaning that they take responsibility on their end. You know,
they have to.
They not only follow through with their treatments, but they actually change their behaviors and their approach as a whole to the healthcare. And one of the gaps is, how do we educate and involve the patient?
Right. So we're going to find that out right now.
Yeah.
Okay. Let's find out.
So the model is pretty simple. Mastery of it is where you really learn the coaching skills.
And that's through you teaching us and practice, right?
Yeah.
The mastery.
Yeah.
Okay.
So at Coach Training World, we have a process called Whole Person Coaching, and it's used globally in health and wellness. It's also used in conflict and leadership. I mean, it's actually applied in many different arenas.
And you've been teaching this for years, 12 to 13 years?
12 years in this format.
International.
Yeah.
Okay.
Yeah.
Okay.
And one of the things that's important is when we're looking at an arena where there's someone that needs to educate and then collaborate with the patient. We actually have a very specific model that we call patient involvement model, or patient involvement method. I mean,
that's a good
PIM,
name for it.
Pretty simple.
Okay, great.
So, and it helps you remember that we're involving others besides ourselves. So the first piece of it is we have to envision success. And a lot of people go, oh, but the person's mouth, or fill in the blank, they can't see the person, aka the patient, is successful, or they can't see themselves.
Right. I'm a golfer, and I know you must envision the shot before you hit it. So this really makes sense to me, what you're saying.
The end result, and so being able to look at the patient and look at yourself and the process as a whole is, there is potential here, there is success, even if you can't see it in the moment. Sometimes the situations are, they're pretty advanced, and it's hard to hold hope, and especially if the patient feels a little apathetic, they're not connected to what this really means. But we still have to extend trust in them.
Right. We know what we can do for them, so we need to get them to see the final picture, extend the trust that we can get there together.
Absolutely. Okay. And so I was thinking, I'm going to lend you my trust, or I'm going to lend you my faith in you, so you start believing in yourself, so you can shift too. And a lot of times people will give themselves permission to change when someone else believes in them.
True. Absolutely, yes.
So step 1 is envision success, and there's different ways to do that. Step 2 is educate. We got to get the facts out.
Right.
There's ways to educate. I mean, if you do it in a neutral fashion, if you really connect to the person in a way that they can hear you, with the rapport and the trust, and there's obviously different techniques and styles to do that. But you educate, and then you literally give them some options. Okay. So education isn't just, here's your pathway, but here are your options, A, B, or C. And if there are only one option, also involve them in what options they have to take care of themselves. So a lot of people will stop at, here's your treatment options, but they don't go, here's your treatment options and here's how you can participate.
You'd certainly recommend a minimum of treatment options. We don't want to confuse the patient.
Absolutely.
So maybe 2 to 3 max.
Yeah.
Okay.
But also what they can do outside of what's in your range. Yeah.
Gotcha. Okay.
So we've envisioned success. We've educated and literally given them some options, and then we involve them. We ask them, so out of what I've just said, what sounds best to you?
Right. Which can you do?
What do you want to focus on?
Right. So now they commit to their own program.
Yeah. And you can even amplify that and say, well, what would you like to have as a complete result of this? So we're starting to get into more motivational pieces there. It's like, okay, what do you want to commit to doing, and what are you going to have that's even better? So once we've involved them, we kind of continue to go back and say, okay, what are they telling me? Do they need to have more facts? Do they need to have more information? Do they need to just know that they're going to feel better?
Different personalities. What does that personality need?
Absolutely.
Which type of personality? So you just draw that out of them.
Yeah, exactly. And a lot of it's paying attention. Are they coming from a more intellectual stance or emotional stance? Is it more feelings involved? Are they more worried about what other people are going to think, or can afford this? What is really driving them? What do they value? So after we've done that, the dance will kind of go between, do I need to educate? Do I need to ask more questions? Do I need to do that? And eventually, we're going to be engaging the person at a level where they're really highly motivated.
Right.
And then at the end of it, we're going to be making sure that they understand that, this is something that's completely in their control and they can move forward. And so there's actual multiple steps. It's more of a dance.
So let's review the 5 steps.
Okay, so step 1 is envision success.
Envision success. Step 2.
Step 2 is going to be educate.
3.
3, well, that's the dance.
The dance. And that is, once again, the going
So
between
typically,
education or...
we would talk about engaging them.
Okay.
Or we might even actually be able to skip that step. So this is the tricky part of a coaching.
Okay.
Because I might just educate and find out that they're already buying in.
Yeah.
So educate and empower them to take the steps, and they're out the door. So
Step
that's
4.
3 steps. So
That's right. So step 4 then is...
well, if we need to put the gas on, we're going to have to engage them at a deeper level.
Okay. And 5 is...
5, basically complete.
Complete.
Yeah.
Okay. What else would you like to tell us to help us communicate and motivate our patients to do what they need to do?
I think the most important thing is most communication. And I know people hear this all the time, but we don't realize how true it is, that we're completely communicating in a way that it's like we send an information out, but it's nonverbal.
Okay.
So part of it is, if we're envisioning success, we're going to portray positive thoughts. Our emotions are going to look hopeful, and our clients and our patients are going to actually go, oh, okay, there is a possibility here.
So
I have hope.
it could be your inflection. It could be your nonverbal clues of body language.
Yeah.
Okay.
The other piece is the quality of questions really comes from the listening, as well as the style in which they're delivered. Are they open-ended, so you're learning more? And a lot of people fear those open-ended questions because we're taught yes, no, to facilitate quickly a process.
Right.
But what you need to do is open up to open-ended questions so you learn a little bit more, but be able to have the confidence to bottom line.
Right.
Meaning, okay, I've got enough information. Great, that's really good information. I hear you, and here's what that means in relationship back to our goal.
Right. But take the time to get what you need to be able to know the options that you want to present that would fit that person.
Yeah.
That's time well spent.
Yeah.
Then you can move through. If you spend that time right, everything else moves faster. 'Cause
Absolutely.
Now you got the trust. Sure.
Well, I think a lot of people also think, I don't have time to change this. I don't have time to motivate the patient. And often we talk about it as you're seeding. And so sometimes this conversation, we talk about the questions, or what I would say coach-like culture, where from the moment the patient walks in to meet the greeter, the front desk,
Sure.
she might be asking a couple of, instead of how are you today, what would you like to accomplish today? How would you like to feel as a result of today's session? You've already started the process.
Right.
As she meets with the hygienist, or being prepared for a treatment, it could be a conversation around, okay, so you're in here for today, is there anything else you'd like to discuss? The question could be carried through, and the whole process that I'm talking about could be participant, I would say split between different members of the faculty.
The whole team.
Yeah.
The whole team. Right.
Which is what we found is really effective, because then it takes no additional time.
Right. If the whole team gets involved, all of them asking and concerned about the patient, and if you're concerned, the right questions are going to come out.
Yeah.
And so then that really facilitates that hygienist or dentist as well.
So I think it's important, the rapport, the trust, what information you're sending by believing or not believing in others or yourself. I think the speed is really about how you ask the question and how you keep linking it back to the results. And of course, I think a piece I didn't mention is the question is moving forward. A lot of people are concerned, I don't want to hear the patient's story. Well, you're going to invite a story when you say, how do you feel, what's going on today? There's the story.
Yeah.
What would you like to do as a result for your teeth today or your oral health today?
Get that story.
Yeah, get that one.
Anything else you'd like to tell us before we close, Feroshia? And thank you. This has been wonderful. Anything else before we close here?
Nope. I think if anyone wants to learn more or talk to me,
how do we get in touch with you? That is the next thing I was going to ask. How do we get in touch with you?
Yeah, pretty easy. The easiest way is Feroshia, and I know it's a little bit different, FEROSHIA @gmail.com. That's always easiest. Or you can look us up at coachtrainingworld.com and just send an email, and my team will get it back to me.
Wonderful.
Or the old phone, I guess, Too many people use the phone.
Okay, so those two, did you want to give your phone number?
Sure.
Okay.
It's 888-660-5588.
There you go.
Yeah.
Get with Feroshia, help your team communicate with those patients. It'll pay off for the patient, and it will also help you practice better. Feroshia, thank you so
Thank
much
you.
for being with us.
Yeah, it was a pleasure. Thank you.